No, Doc, just wait a
Oh,
sec.
okay. There was a bit of a pause there. I'm like, okay, maybe people are waiting for me to talk. That's fine.
No, Doc, we can hand it over to
No, that's
you.
okay. That's okay. Sure.
Glendle, you're on.
Good morning to everyone who's joining us live on our platforms, the various platforms. My name is Nhlanhla Mabaso. I will be your MC for today's session for the Man to Man, the Truth About Men's Urological Health session. I want to start off by asking, what is a man? So I think a man is someone who spends 5,000 rands on tools only to pay someone 500 rand to do the job. That's a man. So, colleagues, I think with that lighter note, I want to introduce our first speaker who's going to be taking us through the very aspects of urological health, which is Ms. Dr. Habo. Dr. Habo, over to you, sir.
Good afternoon, everyone. I've had a very hectic morning consulting, so please forgive me. I'm going to steal a few moments while talking to you to take a cup of tea for myself. It's not disrespect. It's just so that I'm fully alert and away from you. I'll do it while I'm talking, so don't be surprised while I'm doing that. My name is Kabo, K-A-B-O, Ijani. I'm a urologist. I practice in Pretoria. I've been in the field for a while now. I'm a medical doctor since the year 2000, and I'm a specialist since 2012. What urologists are, we are surgical specialists, meaning the greater part of the job we do is operations. We operate on kidneys, on bladders, and general main issues like prostate, testicles, penises. What takes a lot of my time is prostate work, but I do almost all other four pillars of urology. The urology hospital is based in Pretoria and is one of the only urology specialized hospital in the entire continent, with all the other aspects that we have. And we treat men's health in all its entirety. The reason I laughed when you say what is a man, you're opening a can of worms. So, because in the world we live in today, with issues of identity, issues of gender, and etc., that can be a very, very broad topic. Thanks God you didn't ask me to go into that. I wouldn't. I would have declined the invitation. I was invited to address a few topics, but some of them I'm going to make mention of them, give directions, and I will focus on circumcisions, mythbusters. I'll speak a little bit about male infertility and andrology. I will then afford sometimes also to testicular cancer. Let's just take urinary tract infection out of the way because it's an important topic, but it's more of your GP, your family doctor will guide you a lot on what a urinary tract infection is all. By the time you see a urologist, you probably have gone to a step where now you need some sort of surgical intervention, endoscopic work, camera investigation, and etc. But what we commonly call a urinary tract infection, it's a few cluster of symptoms where your urine is burning, you are unable to hold urine for long. You could be very sick, or the symptoms could be recurring and mild. It's broad because those symptoms are not exclusive to UTI. In my practice, I see people come in and say, Doc, I'm suffering from urinary tract infection and I'm saying, was there ever a test done that confirmed that you have a urinary tract infection, and you see their eyes popping and you know that it probably wasn't done. So if you've got those symptoms, you've got symptoms suggesting a urinary tract infection, meaning germs in the bladder. You can have inflammation. So what's the difference between infection and inflammation? It's if you bump your elbow on a metal object and it's swollen, it's red, or you are playing, for me, man-to-man used to be when we were playing soccer, when we did what they call now individual marking. That's what man-to-man was for us. So you tackle the dude. So if you've been tackled, rugby-wise or soccer-wise, or then you have a bruising. That process is inflammation. Infection also creates inflammation. When your own body is reacting to itself, that's called autoimmune disease, it will cause inflammation. So those symptoms of burning urine, I can't hold urine, I have to rush to the toilet, sometimes it comes out before I even get to the toilet, could just be inflammation. And under that inflammation, infection is just one cause of inflammation, like I've mentioned. Therefore, when you go to see your doctor, it does not necessarily mean that because your urine is burning, therefore you need an antibiotic or an antibiotic. You don't need an antibiotic. You need to be assessed. We need to do tests. We need to see, is this really a urinary tract infection or not? If you are a man and you are diagnosed with a urinary tract infection and it is confirmed as doctors know how it should be done, by definition, it's called complicated urinary tract infection. Because anatomically, meaning the way we are built, the penis, it's an appendage, it's something hanging out, and you've got a urine pipe, you've got capilla, gate, and borders that any germ should pass before it can even get to your bladder. And therefore, by the time you get a urinary tract infection, you need endoscopic work. But this means that we sent urine away and we confirmed on a laboratory test that indeed your symptoms are from an infection. You will then need to see the urologist for more testing. The story changes in females because the urinary opening happens in a canal called the vaginal canal, right at the top. And in that canal, tampons can go in, water can go in when we bath. During intimacy, things can go in, whatever goes in there. And just neighbor, next door to it, there is the exhaust, the anal hole. And with panty liners, sanitary pads, and etc., it's very easy for germs to creep and go through the vaginal canal and find their ways into the bladder. So it's not heard of for females to get recurrent urinary tract infection, which is confirmed, which is not necessarily complicated, and that can happen in about 30% of females. So that's the most important thing I just needed to highlight here. So if you're a man and you're diagnosed with urinary tract infection, usually your GP, your family doctor would have done the job, your physicians, and then they can pass you on to the urologist for more testing. Kidney stones is a very important topic. What are the stones? It's not the rocks that we pick up from the street. These are salt crystals. Think of fine salt on your table and coarse salt, which sometimes is used for whatever the reason might be, from treating circumcisions, which I will get to later, which shouldn't be done anymore, to using it for inducing vomiting, to wash with it, to cast the spells, whatever you might be using it. Those little coarse salt crystals, that's what exactly a stone in a human body is. It's formed of different salt compositions. Vis-a-vis, calcium is the commonest, and together with it, you'll either get chloride, phosphate, magnesiums, and the crystals of the salts aggregate and cluster together in something that look like an individual crystal of coarse salt. Now you can imagine that jagged little crystallized material coming through your urine pipe. Any of us, if I ask you to pinch it in your finger, it's going to hurt you. Now, if it's going through your urine tube, which is now pumping it, it's going to cause you excruciating pain. So what I'm going to say about kidney stones is that they are not uncommon, meaning we see them. They've got a clustering in certain populations, amongst the Indian populations, amongst the Caucasians in South Africa. And of course, you do get them even in the Black population, albeit to a lesser extent. We don't know whether it is dietary genetics or anything. There are theories, but nothing is fully concrete and fully answered. That will take you to the hospital if you've got kidney stones. Generally, you could have flank pain, meaning pain on the side of your body or towards the back. Remember, guys, that's not the only thing that can cause pain on that spot. So it does not mean that that pain that you've always had from arthritis, all of a sudden, after the talk today, now that is a kidney stone. However, if you are concerned that you have kidney stone, a simple examination with an ultrasound as a screening tool might be useful, and then your urine test, and then you could have more definitive testing in the form of something called computed tomography, short CT scan, which is an advanced scan where you go through a donut-like structure, and we take layering and layering of scans. If we do indeed find you've got a kidney stone, we have to risk profile you, and most of the time you need surgical interventions, usually 2 procedures to remove that. There are instances where we can remove all your stones in 1 procedure. It's a talk for another day at an individual's level. So why do stones form? Think about it. We need enough solutes and we need enough solvents. So there must be salt and where it is dissolved. So either you are passing lots of salt and therefore there is excess salt in relation to the liquids that you have, or you don't have enough liquids, even though the salt contents in your body are okay. Therefore, the imbalance between salts and liquids is the reason why we get stoned. The second one is biology again, our human body. Some of us, their kidneys are leaking higher quantities of salts than they ought to, and you were just born like that. So even though you are drinking copious amounts of liquids, you are still leaking lots of salts, and we call those people salts formers. There are certain chemicals which are preventative for crystallization. So in a solution, they will prevent the stones from aggregating together. And if you've got less of those, then you will also form stones. So you could be just born to form stones and it's nothing you've done, or your lifestyle or your environment could also predispose you to forming kidney stones. And in that instances, you would present with pain, sometimes blood in the urine, and you'll be seen in the hospitals, you'll be assisted. Generally, healthy eating, Mediterranean type of diet, see dietitians for details on healthy eatings, but drink increased liquids. People will tell you beer dissolves salts. There's no studies confirming that. It shouldn't be the justification for you to become a gluten, but you can take increased amounts of liquids spread out through the day. Mostly that will help. For highly specialized stones, your doctor would have made a diagnosis and they will guide you if there are dietary things that could assist you in minimizing the number of stones that you form. The unfortunate ending statement for this is once you form stones, some people become bona fide stone formers. I mean, every 5 to 8 years, you're going to come back with stone, no matter what you have optimized, and it is just nature. So you could be one of those people who are very frustrated because of that, and usually discuss that in detail with your specialist, with your urologist, or with a kidney specialist called nephrologist. But if you ask your general family doctors, they will point you to the right directions. So that's the 2 summaries on urinary tract infections and then on kidney stones. So I don't know if it's clear enough, and then I'm going to move to the other topics or something like that. All right, let's talk about circumcision. The reason I'm saying I've been so busy and I'm still drinking tea while talking to you guys is because I've been seeing lots and lots of boys which we are planning to do circumcision during this time. This morning when we were driving to work, my boy, he's 17 years old, he asked me, Daddy, why do everyone come for circumcision in June? And I told him, probably it's tradition. People used to believe that in winter, it's time to go out into the bushes or the mountains or the forest or the cages, wherever you go, as a rite to passage to manhood. That's African traditional. You have religious beliefs why circumcision has been done within the Islamic religion. within the Jewish religion. They do it as a right and connection, or as a prescription from God and serving the gods. So everyone have different reasons for do that. Male medical circumcision is what I'm going to talk about. What does that mean? That means that you've got a foreskin, we call it prepuce. I simply explain it to the young boys like it's a trunk of an elephant. Now, that trunk of an elephant, it's sucking water, dripping it and licking it. So I'm sharpening it like a pencil. And that is also applicable to all people. The message, get home. The medical reasons for doing that is that when we are born as boys, only 3 out of every 10, you will be able to pull the foreskin backward. Other than that, it's adherent, it is stuck to the head of the penis, so you can't see the knobkiri of our penis because the skin is covering it completely. And over your growth up to 17, it will end up being only 1 in 100. So 1 in 100, you won't be able to pull it back. At 17, at birth, 7 out of 10, you can pull it back. And it loosen up from erections and as we grow older. With that, it traps under that skin some creamish, whitish, thick material, which is called smegma. We've seen it when you roll that skin back, it's yep, this is not looking too good. And sometimes it's really stuck there and it could be infected because it's tripping urine. So that could be one of the reasons. You could get infections. If you were to develop cancer underneath there and you are not able to see, you are not going to see it earlier. It's going to be later. When you are being intimate and you've got a foreskin, that little trunk of an elephant, when you go in and come out, acts like a vacuum, and it can suck and trap secretions from whatever orifice, an orifice means a hole, from whatever orifice it is that you are going in and out of. And that can suck germs. So therefore, there's a slightly higher risk of infections with that. South African studies in collaboration with the World Health and Kenya, Uganda, from Orange Farm in South Africa, studies were done to show that if men are circumcised, they are less likely to catch or to contract human immunodeficiency virus, HIV. I'll repeat that statement, and I'm intentionally speaking slow so you can hear it. You are not immune. The risk for contracting it is reduced. You can still contract it. And if you're going to keep exposing yourself, you will contract it. However, as former part and parcel of nationwide screening and prevention of HIV infections, the South African government, guided by the Department of Health and the ministry, embarked on rolling out male medical circumcision programs as part and parcel of that. There are other reasons which I'll rather not go into here because they could become controversial. But if you look at the news, there are reports daily around this time or maybe weekly of instances where there have been accidents, mishap of otherwise healthy young boys who went for right to passage to manhood, and either they ended up with horrible infections, they lost their manhood, and some of them have lost their lives. Now, the reasons why that is happening is not what we're going to discuss here because it's very emotive to different people. It needs the right platforms guided by evidence so that people do not feel like a culture is being attacked. However, the reality is that it takes anybody of us who watch and listen to the news. Every year we do death tolls. So many boys have passed away. So many boys have passed away. And most of those were otherwise just normal, healthy young men whose only wish was a rite of passage to manhood. So there are all these reasons why we have to have this conscious and awareness about male medical circumcisions and the best way how it should be done. Between culture, health, professions, and everything, things should be merged together. There's a general tendency out there to call modern medicine and what I am, it's called Western medicine, which could be a myth because if you go back way before the Anglo-Saxon world, during the pyramid times, even before Nubia, you'll find that medicine existed all over the world, in all corners of the world. It's just that we have compartmentalized what we call civilization, and sometimes it is used to justify certain things or to attack certain things. My statement on that is it's very painful if a life is lost for something that could have been prevented and really shouldn't be happen, and the responsible people should be looking at that. So why do men do circumcision? I'm summarizing that again so there's a good take-home message. It's either for your religion, right to passage for manhood, or for male medical circumcision for medical benefits, where we do it to prevent infection, seroconversion, and everything. And then I'm sure some guys and ladies in the audience are wondering, is that other thing true, where a circumcised penis is a better lover than an uncircumcised penis? so there is no evidence to suggest that, and I'm not in a position to can share subjective experience on that topic. So medically
Don't give us a hint. Give us a hint.
it's a myth. It's a myth. Sex is a complex thing, and that's why I'm saying I'm not in a position to subjectively say that. Sex is very subjective. That's why another person will be aroused by same sex, and another person will be aroused by the opposite sex. That is sex for us. Another person will look at the circumcised penis and they'll say, definitely that's exactly how it should be. And in their mind, the job is going to be done. But because subjectively they are now open and receptive to this and they believe in it, just get your partner to believe that you're going to do a good job. That's all that matters. If you have premature ejaculation, meaning that every time you try to get to intimate and engage, you finish quickly, cutting the foreskin does not necessarily solve that. But if you are married to somebody who believes that you'll be a better lover when you are circumcised, until you circumcise, you're not going to be a better lover for them. And usually we say for better, for worse, so you better lose that foreskin for their sake. But it does not necessarily make you a better sexual lover if you are still going to behave like a cock chasing a hen, grab and jump off. There's all these other things around sex and sexuality, foreplay, the mentality. It's a mind game. You win the mind, you've won the war. You cut the foreskin only and you don't win the mind, you have lost before you even start. So reality is that, medically speaking, it does not make any difference for you at all. It's a subjective thing. We don't have medical proof that because now you are circumcised, you are a better lover, or you last longer, or your premature ejaculation is cured, etc., etc. And even that longer, lasting longer, it's really very subjective because studies were done to show that an average sexual round, as we call them, it's only 3 minutes. The intensity of it make every one of us think we've been at it for an hour. But you were just there for 3 minutes. Tough luck, guys and girls. You done, finished. But the foreplay, the cuddling, and everything that you do around that, it's what matters. So that myth, we can bust it. Don't send somebody for circumcision because you think it's going to make them a better lover. Look for a sexologist somewhere in town. Go for counseling together. Because some people, you need to start in the morning to warm them up for hopefully to get lucky at night. And that's the reality. And you can be circumcised. And if you're not going to help with the dishes and the kid and everything, you're probably still going to be a worst lover forever. If they love you and they're embracing that you are helping and they're very excited, believe me, they'll tell you, leave those dishes, I'm coming now, or I'm quickly bathing, then you know, oh, I'm going to score tonight. So all those things are very important for our sexuality, guys. And the foreskin is the least of our worries. So if you're going to look for medical circumcisions, it is because we can prevent infections, We can minimize the risk of you presenting with advanced cancers. We can minimize your risk of contracting the HIV virus. And the other ones are religious and cultural, and I'm neither a cultural or a religious expert. I'm a medical expert. So that's circumcisions. How it's done, it's very broad, but usually we cut the foreskin and then you heal and then it's okay. There are differences between what people prefer, what they don't prefer. If you look at West African countries in the corner, I know they don't like us a lot lately because of much, but it's the reality. We have to speak about these things. They tend to want to cut the outer skin a lot lower and cover it with the inner skin much higher. Whereas in South Africa, we tend to cut it a little bit higher and it varies all the time. So more often than not, I get asked an opinion, did they do the circumcision right? And I usually say, circum is circum. If the wound is healed and the penis is okay and it's still erect, usually that's okay. I do it totally different. I've got the other different ways to do it. And I've given videos and talks via Bonitas for how to do proper circumcisions as a guide. It's not a prescription. And we do a lot of that. But that is the story on circumcisions. Testicular cancer, it is cancer. It is a topic that with us in the country, it's not a big problem as it is in Scandinavian countries where they've got the highest incidence. And that highest incidence, it's maybe 3 per 1,000. So it's still low amongst male cancers. But key to testis cancer is that all of us, think of what we teach the females, breast examination. We must also have ball examination. You must play with the balls. You must examine those testicles. You must know what you have and what you don't have. And if there is anything that you are not sure what this is, or something that has not been there and now it is there, the best is to go consult. Because there's not much information I can give you about testicular cancer here. Other than that, self-examination is very important. The peak rate of testicular cancer, unfortunately, is in younger men, 13 to 21, up to 25. So while we are still reckless and not wanting to take advice, so if you've got teenage boys, when they are still younger before they hit 13, teach them to examine themselves, have those talks with them. As much as you talk to them about drugs, girls, everything, or boys, I don't know, whatever you talk to them about, those things are important. You must also include the self-examination and keep encouraging it as a message in religious institutions. When Bafana Bafana is winning like they did today, we are celebrating and say, did you examine your balls? We scored. No, don't do it to that extent, but that's something we must do. And if there is something that hasn't been there, go see the doctor. We will be able to guide you because a lot other things can be a lump on the testis which are not necessarily cancer. However, a lump which is cancer that we miss can be lethal. So let's repeat, a lump in your ball is not necessarily cancer, and most of the time will not be cancer. But if it is cancer, we need to know early because it could become life-threatening. So self-examination, self-examination, self-examination. I'm going to give some time to talk about male infertility, and then we will open the floor for questions after male infertility. We are reproductive beings. I'm Christian, so God gave us a command to multiply. And so we must multiply. That's our duty, our heavenly duty. It's also a burden because somehow society has taught us that if you do not have a boy child, the same name is going to die. And therefore, as a man, you feel like you must leave that seed behind so that the Ijanis can continue to exist. That's the world we have been raised in. Our children and grandchildren might grow and be raised in a different world where they can go to a sperm bank, use sperm donations, surrogacy, adoptions, and everything. So that burden of carrying the name of the surname of the entire Mazibugu clan might not necessarily be such a burden that like it is on our current generations, the 40s and above or 30s and above. So it is a very emotive issue though, because in heterosexual marriages, 1 in 2, around 40% of the time to 50% of the time, when there is infertility, it's a male factor. So the man in heterogeneous relationship, male and female, is the cause of a childless couple 40% of the time to 50% of the time. So before you look at the Makoti and say, hey, we paid so many lobola cattle and now we are not getting any air. Just look at your son or your brother or your uncle first before you pass all those things. It's very, very important. You will be surprised how many couples I sit with here where it is the man who cannot plant their seed. And it does happen that when that relationship is broken, the female is so hurtful that she's pregnant even before the year is over to prove to the entire world that it was never her problem. So we have to be very, very careful about that. So I'm going to be very organized in how we're going to approach this. We start from birth. What can you do? As we go on, I'll feed in more information. So when a boy child is born and we are excited, we are naming them, we are reciting our totems and performing the rituals. Wara, go back, when you are done, just look that he does have 2 testicles, please. And they are there in the scrotum. As a parent, as an uncle, as an aunt, as a brother, a sister, just quickly do a quick examination. If you're not sure that both testicles are there, usually the midwife will give advice. If they are not sure, the GP will. If you're still not sure, just see a specialist or even a pediatrician. They will be able to tell you that, sorry, this is okay, or there's an issue. And the reason for that is because the testicles must be in the scrotum. We call them the gonads, but I'll choose colloquial words. Testicles must be in the gonads, in the scrotum. They must be hanging loose. They are not just there for toys when we are being carnal. They are there to be cooler than the core temperature of the body. So if they're exposed to high temperatures, they do not produce sperms. Testicles must be hanging and cooler than our core body temperature for optimal sperm production. In the event that they are exposed to heat, be it because they are hanging up in our body, or we work in super hot environment like certain mines in South Africa, in some other areas in South Africa where you go 4 kilometers down, somewhere in the Rand, that's very hot areas. That heat can affect that. So equally, it could be because the testes are abnormal. Now, the reason why you must do it at birth is because by 2 years, 18 months and 2 years, we need to have brought down the testicles. If we miss that window, you are forever going to have poor sperm quality, if at all. And in some instances, no sperm production at all. And that's for me what I want to be the take-home message in pediatrics, in kids. So those young boys, when we are very happy and performing whatever it is, religious chastities, cultural, traditional, whatever, just make sure that we do have testicles down there. If you're not sure, seek professional help that we confirm that they are there. And if there are issues, a procedure must be done where possible to bring them down before 18 months of age. Otherwise, we risk infertility in the future. And then we get to teenage years and everything, things like mumps injections. And these are simple, practical things for take-home message. There are people who are anti-vaccines. They've got the right to choose what they want to be. It's not for me to change your mind. South Africa is giving rollout of vaccines for a virus called mumps. You get it in private, you get it in public. If you were to get mumps just around your teenage years because grandfather and dad were anti-vaxxers, and then it swells, it could destroy the factory that produces sperms in you. So what's the take-home message? Vaccinations against mumps can prevent fertility problems in the future. So that's very important, guys. And then, of course, there are conditions that can happen where we are growing up. Chemical sprays, hydrocarbons. So be careful what industry you work in. If you are in a farming environment and we use a lot of pesticides, we spray crops and all the likes, just try to make sure you've got protective gears. Put it on your children too. Wear the mask. Little ones must not necessarily be there. Keep them busy with something so they feel part and parcel of farm work and everything else. But move them away from that, because eventually all these hydrocarbons and these pesticides can disrupt sperm production and testosterone productions. Very, very important. So you need to look at those things. And there are medical conditions called torsion of the testes. This is a condition where a young man grows with both testicles, and around teenage years when they hit growth spurt, the testis can twist on its own axis. Think of a yo-yo. A yo-yo is being held down by a string, and then it can spin around or up and down. And if the testis was to spin around and up and down like that, it's going to cut its blood supply, and without the blood supply, it's going to die. And if it happens, we need to fix it. We've got 6 hours. So a young man waking up telling you, Mom, my ball is sore, especially if they are nauseous. You don't phone your GP. You get them in the car. You call an Uber. You call an uncle. You call Jonas. Somebody has published Jonas there, so I'll mention Jonas on my sideshow of the webinar chat. You call Jonas. We get this guy to the hospital. To the hospital, not the GP room. They assess him and they tell you there's no torsion. That's safe. You don't sit there and say, we'll go in the morning. We do understand our country, the broadness, the inequalities, that it might not be possible. The ambulance might take forever. If you get along with your neighbor and they've got a car, get that child to the hospital, please. And if you are that neighbor with the car and she come running and say, my testis has got, my child has got a ball pain, don't ask them, what does it need for me? Just help, for goodness sake. Take the child to the hospital, please, gents, or timas, grandpas, or mamas, because sometimes it's the mama with the car next to yeah, uyandelela. Namhlanje ufuna ngikusize. Those things, we need to get that child to the hospital, please, and then we can tell you, no, this was not torsion. Because if it is, we need to fix it to prevent issues of fertility. And then we grow older, we get our own identities, we become Rastafarians, we smoke ganja, it makes us feel good, but the herb, not too good for sperm quality. The drugs, not too good for sperm quality. And then you find out that Jesus made wine and you drink yourself into a glutton because Jesus gave people wine to drink. And then you realize that excessive drinking damages sperm quality. So alcohol is meant to be social in its whole entirety, not drunkenness. If you're going to become a glutton, not only do you compromise sperm qualities, but there are other things that you all know about, which I don't have to go into, that are coupled with what could happen with alcohol. But over all those many things, the sperm quality will be disturbed and it's not going to be all right. So all those things contribute and affect. And then you go to the gym and say, yeah, man, you want to wake up, be a bit of an Arnold Schwarzenegger when he was younger, show 16 or 18 packs, and then you realize that the muscles are not coming, and you pump in some steroids, voila, there goes your fertility also. Okay, so be careful about all those things. Please, please, please do not use drugs. Don't use anabolic steroids. You can be strong without being bulky, because there are bulky people who are not strong. They exist. When you see them, you're like, hey, what a mountain of a man. And then you realize, weak muscles, they were not toned and conditioned. So it's very important. It can affect everything else. So please put the work, do it over time, do it proper, and you'll become that strong, well-toned person and still be loved for being nice and beautiful. If you're going to take those things and you have infertility, don't be surprised that is the case. So that kind of like put it in a nice, simple perspective for you as a flow diagram of how and why you could end up being infertile. And coupled with that is something we call andrology, meaning something to do with our own testosterone. Now, a lot of those things can also affect our testosterone production. So summary of this is that a testicle produces both sperm and testosterone. But for sperm production, we need testosterone to be present. So testosterone must be there and only sperm will be produced. But nature or the creator has made it such that if I give you testosterone from outside, it does not help your body to produce sperm. Let me repeat this again. Your body will only produce sperm to your body's own testosterone. So any testosterone you get from outside via a tablet or an injection will do other things, will give you an erection like a horse, you'll feel strong like an elephant, but you are just going to ejaculate watery without any sperm. Because the body doesn't work that way. And the reason for that is because that testosterone that you get from outside does not penetrate the gonad, the skin of the testicle. Think of a testicle like a golf ball, and now you are trying to put water inside the golf ball. And that is the analogy you should think about if you were to take testosterone to try to cause sperm production. So every time you take testosterone, maybe you are the blesser, and you realize that she's now getting naughty and you want to punish her, inverted commas, whatever that means, and you go on and you take testosterone just for one weekend to go earn your glory for that day, you may have just damaged your ability to bear children. I find very funny stories from old men to young people, and I'll share this before I opened up the floor for the questions. I had an elderly gentleman of about 81 years old who came to my practice and said, Doc, I heard you guys have injections that can help me to get erections almost like I'm your age. He's looking at me. I'm like, oh, okay, maybe I don't have erections, Opa. And he laughed. He said, but you know what I mean. And I'm like, okay, but why would you want to do that? Because you've got a heart condition. And then me and him, we talk. And literally, he was not necessarily a safe candidate for that treatment. And I tell him, Opa, this thing can kill you. And he says, no, you know what happens with that Oma, that grandma? She does two things I hate. One of them, she found me looking at her and she just like, what's the point of looking? You're not going to do anything to me. The second one, she told me that I see her talking to the gentleman next door. Udlami. And when I go closer, they change the topic. I can see they are no longer talking about what they were talking about. So I need that injection to go earn my last honor. And the reason I'm giving you that is that even middle-aged, younger age men, we've got this perception that I'm going to punish her. Give me that injection. She must respect me today. Be careful if you're still within the age where you want kiddies. She will respect you, but you've just blown away your abilities to have children for good. And it becomes difficult and a different topic for another day, what things can be done to assist you. However, if you consult a fertility specialist, we can do things from sampling from the testes, aspirating, trying to suck sperm, opening it up, and looking to see if we can get sperms. And that will be used for something called assisted reproduction with the fertility clinics. So all is not lost, but you really don't necessarily want to put yourself in that condition. I think it's enough talk for the past 45 minutes. We've got about 15 minutes of interactions. If you've got questions and any other things, I'll be willing to take them and then we can take it from there. Thank you.
Thank you so much, Doc. I really appreciate a very detailed chat. Indeed, my apologies. I think our program director has maybe network issues. I see that his face is frozen. But without any further ado, let me rather read out some of the questions that appear in our question and answer Q&As. Doc, there's a question from one gentleman, and he's asking that what happens, what is it normal for one to wake up 5 times at night to pee? Is that a normal reaction in that regard? And maybe
Okay. I'll
let
take
me
more questions. Give me about 3.
sure. And there's a lady who's also asking, can tight clothes affect sperm count? The third one, my boy takes a very hot bath. Can that affect fertility in that regard? Thank you.
Thank you.
Thanks.
Yeah. Yeah, we'll group 2 and 3 together because tight clothes and hot bath, they all go to what I said. Testicles are meant to hang. So if you're going to forever be on tight clothes, leather clothing, squeezing them so close to your body, as much as if you're going to spend long hours into hot bath. Nothing wrong with you once in a while taking a nice bubble bath with whatever it is, candle lights, walking roses. Yeah, that's normal. It's life. But it can be a habit of every day because then it becomes an issue. If now every day when now you are in this boiling hot bath, you are cooking the eggs, you are boiling the eggs. I wouldn't recommend that. And so the same, I don't know who wear tight clothes all the time. By the time you take those things, like there's no circulation around your waistline, you've squeezed everything so deep into your body, you are very uncomfortable. So where at all possible, tight clothes must be for occasions, maybe to charm or to enhance things in certain areas so that they can appreciate, but it can't be your fashion all the time. When you are doing sports, playing, running, or doing something like that, nothing wrong with that. But as soon as you are able to, please loosen up. And if I can give advice when you go to bed, don't sleep with your underwear. There are many benefits other than that tight thing to sleep without the undie if you married, I mean. So yeah, that is covering those two. To wake up a lot at night can mean many things. It's not necessarily normal, but very first question that comes is that if you have chronic conditions, sugar diabetes, if you've got what we call obstructive airway illnesses, meaning do you snore when you are sleeping? Those things can cause you to wake up. Or are you a person who otherwise struggle with sleep and because you are awake, you are forced to go to the toilet and not the other way around? Because sometimes we've got serious problems. I've bought a Rolls Royce, which I don't afford. And then I wake up at night sweaty because of debt and SARS, the new doctor commissioner. You worry they are coming for you. And now that you are awake, you go to the loo. So make sure it's not because of the other. It's more like the urine is waking you up. As you grow older, it could be prostate illnesses where when you empty the bladder is not completely empty. But more importantly, look out for things like sugar diabetes. Watch your habits. Do you pee and then after you've peed, you drink half a liter of water from the tap? Definitely you're gonna wake up again in the next 2 hours or less. So also just watch the habits. That is not the reason you're waking up is because there's a 2 liter jug next to your head and you are taking in what comes in must go out somewhere. So that could be that. However, I'll recommend that you just, if that is the case, just consult your local doctor. They will go through some of the stuff I spoke to you about, give guidance, and if need be, refer you to the relevant specialists.
Thank you, Doc. And there are some other 2 questions. The first one is what would boost fertility faster in men? And then the next one is do multivitamins like Centrum help with the quality of sperm?
Not necessarily Centrum. It does help, any vitamin help, but let me answer it this way. Sperm production is a highly regulated system within our body. And before you say, I want to boost fertility, it's always good to just consult so you can be fully informed on what it means to be infertile. All right. So this, just to bust one myth, people look at the sperm and they say, my sperm is light, therefore I'm not good and I'm not fertile. Or they look at it, say, it looks dense and strong. All those are stories. The only thing that will tell us if there's issues is for that sperm to be analyzed in the laboratory. We are going to look at the volume that we ejaculated, worst case scenario, 1,5 ml. Now think a teaspoon is 5 ml and 1,5 ml, it's normal ejaculation. So like other things in men, is not really what it is. We always ejaculate much less than we presume it is, as much as I said with our rounds in the earlier days. So 1,5, it's accepted as normal. And then within that 1,5 mils, we expect about 15 million sperms per mil. And that will be checked in the laboratory, but it can go as high as 100 million per mil. And all those many, many, many millions of sperms, only 5% of them must be normal for us to say you are a normal fertile man. Because graphs and tests have shown that that's the threshold where you become subfertile. So if 95% of what you ejaculated is abnormal, I was jokingly telling the audience the other time that I know there are where 33% is a pass. Here, 5% is a pass. That's what it is. Now, all that helps you to understand what fertility is. So you just have to be careful what you mean. Once that is understood, vitamins, if you eat balanced diet, a lot of vitamins and nutrition and necessary food is there. So if you overdose with supplements and vitamins, you end up with very expensive urine. Your body needs this in little quantities. That's why they are called trace elements. So usually I say you can actually take vitamin supplements weekly unless prescribed by the doctor. You don't have to take them daily because your urine just become, it smells like vitamins, it looks like vitamins. You are just wasting your money. So it doesn't help. However, there are other things that have been medically tested, and it's a spectrum of drugs, and they go like fatty pill, sperm go, Prelox, male fertility, Insumex Q, and other stuff. So if you go to just a normal retail pharmacy somewhere and you ask them, where's the corner for sperm boosters? They will show you to that direction. And in there are certain trace things, arginine, lysine, and zinc, which has been shown to can improve sperm quality in about 30% of men who started with poor sperms, taking that medication for about 6 months. So it's not like I take for 1 week and I'm fine. You have to take the medication for about that period. You're free to consult your doctor, health profession for a little bit of guidance, or even just ask AI. Nowadays, there's Dr. AI. Just be careful with Dr. AI though. Just verify that with the medical experts because they draw from whatever you give in there, garbage in, garbage out. So if you're using AI, be careful what you are feeding in. You'll get exactly what you fed in being fed out from the pool of whatever exists out there. So if a lot of misinformation exists, AI will summarize that misinformation for you very nicely. So just be careful with that. But however, generally, it's quite useful to give you some hints and guides and then just verify that we have no problem with you being informed. The issue is now if I have to argue with Dr. Google, then that doesn't help because sometimes it can be that.
At least, Doc, you don't have to argue with Dr. Dre. Doc, the next few questions is how long is the healing process for an adult after medical male circumcision? And how long should a young adult male start receiving morning wood after circumcision as a sign of a healed penis? And then the second question would be, what symptoms should men not ignore when it comes to genital health, apart from the UTI and the STIs that you have mentioned?
Okay. Kids, young boys, preteens, pre-puberty, they heal quicker than pubertal and post-puberty. And usually it's because of erections. So it's normal to get 3 to 4 erections from puberty onwards. You are healthy. And as you grow older, they disappear until there is nothing. So for all those 40s and above in this audience, don't wake up tomorrow morning and say, Dr. Jani say I must be getting 3 to 4 erections. You are lucky if you are getting any. That's the stuff for young men. As you grow older, they just go away. All right. So because now you've got a wound and you get an erection, the wound keep gaping and opening up. So it just takes about 3 weeks to heal on average, and sometimes it can heal quicker. Also dependent on what was used to repair your wound. Was this a stitch? Was this glue? Was this a clamp? Just verify with that different method of doing circumcisions. So just verify with whoever has been the provider. But a ball figure for older gents, puberty and above, it's about 3 weeks, and the younger ones, it's about 10 to 14 days, and they usually are healed. So getting a morning erection is not a sign that you are healing, it's a sign that you are younger, or that you are still a little bit healthier and you haven't done the deed in a while because you had a wound. So you could just be horny. Sorry, that's the frankness of it. You haven't been getting down and busy, and that's why. And then, but usually it's also a good thing, because that little pause while you are healing create the hunger, and then it just go on to re-emphasize the myth that, after circumcision you can do miracles. It's because you've been starved for a little while. So if they starve you for about 2 weeks, even if you're not circumcised, by the time they say, come this way, you might perform some miracles. So it is just that, hunger fulfilled. Genital health, a lot of the stuff we have covered, but generally speaking, genitalia is almost like your armpits. Okay. So what happens if you don't clean your armpits properly? They smell. You can get boils. You can get lumps. The genitals are not any different. We all have our natural smells, and there is a genital smell for every one of us. Usually it must be a clean smell, not a dirty smell. So generally, normal hygiene. Just keep normal hygiene, and then look out for anything that has not been there. If you've got funny rashes, if you get big boils that are surprising, maybe you shave, you will have small boils. We all know if you cut your hair behind your head there, you can get the little lumps. And if you shave around genitalia there, you can get some little rash and bumps. That's all right. Be careful with excessive, obsessive cleaning, where you want to scrub and sterilize that area. It doesn't help. Ask me, we spend time in theater scrubbing our hands. And if you ask Dr. Google, how long does it take for your hands to be repopulated by germs again? Less than 15 minutes. That's why we glove. Otherwise, we're going to scrub our hands and operate you with our bare hands. So we scrub and we put on gloves so that whatever germ repopulates is underneath there. So you can imagine, if you're an excessive, obsessive scrubber, you can end up causing skin texture changes and all that, and any other growth or lump that has not been there. So generally, that's what it is. So general cleanliness, guys, it's more important. And then just know yourself, and whatever that has not been there need to be double checked with a health professional.
Doc, just to add on that as a follow-up question, then what is the cause for pearly pupils, specifically with men?
Yeah, okay. What if you don't know what pearly pimples are? Some boys, some men, we have little pimples around the head of our penis. And mostly it's common when we're not circumcised because it's moist and wet. And by far, for almost everyone who's circumcised, it's going to disappear. It's also common if there's no proper hygiene. So if you're not circumcised and you are able to retract the skin and clean underneath there, usually they will go away. In some instances, they're just there, circumcised, cleaning, and anything else, they are just there and they stay there. And usually they will be there and they just need treatment. Not really. They don't need nothing. They don't. They don't go to the dermatologist to bend them. Some dermatologists will, using small lasers. The urologist will send you to the dermatologist. But in essence, unless there is pus and anything, those little pimples are just who you are. Just leave them alone.
No, noted, Doc. Then
It's
the next
1
set of
o'clock.
questions,
I'll take the last question if at all, and then otherwise I'll have to thank you and go.
can I give you two quickly? The one says, how
Yes.
long does it take for another reaction for a man after sex? So, and what happens if you don't have an erection after sex? And then the second one is, if I were to appreciate on how men under the age of 40 can best reduce the risk of prostate cancer, what would you then say would be the early signs or lifestyle adjustments that need to be done? And then secondly, the gentleman wants to inquire about the appropriate response in the cases of testicular toxin in children. So maybe what would then cause it within children, and how do we then prevent it?
Not much you can prevent in testes in children. Examine them, get them checked. If you're worried, like I said, rather consult a doctor to guide you, especially if you are worried about testis cancer in children. There's not much. What I've mentioned in environmental factors through that talk covers all that very well. So just revert back to that. There are no signs for early cancers, guys. By the time you get signs for any cancer, it's probably an advanced cancer. There are no signs. We need to pick it up when you don't know you are sick. So just know your family history. Are there cancers? What cancers? And this goes way beyond prostate cancer for all cancers. If there's colon cancers in your families, know about that. If there's breast cancers, know about that. If there's prostate cancers, know about that. And then with regards, particularly to prostate cancer, at the age of 40, as an African man, we need you to get checked. As a white South African, we need to get checked at 45, and that also goes for our Indian and other tribes or other people in the country. So get checked with your doctors. There's lots written about what could prevent prostate cancer. Most of it is get checked, healthy living, and then lycopene in tomato sauce and in carrots is the only thing that could assist. So do eat tomato sauce, don't smoke, don't drink, get checked. And a lot of that is a lot of myth, because most of those cancers, you're not going to know you have it until you come to see us. And that's the most important thing. If I can drive any message home, you don't wait for any signs to say, hey, that is the sign that I've got cancer. We want to pick you up before you see anything. So you are 40, you haven't seen the urologist, make a date with one. Or in the event where they are not accessible, like if you don't have medical aid and the waiting period in the state is too long, a general medical doctor in South Africa is trained to investigate you for prostate cancer, up to a point where if you need a biopsy, they will send you to the urologist or anywhere else. So no despair. You can still get checked by your own GP. Very, very important. With regards to sex and rounds, it's also a myth, because today we are busting the myths. It's a myth. Whether you have 2 or 3 rounds doesn't matter. You don't necessarily have to have an erection immediately now that the other you've just done with the other round. Some men will just do one and that's it for that day. They don't recover. And the very same men, next time they'll have 2 or 3 erections in one night. It is just life, guys. We don't have to put it in categories. Remember what I told you when I was starting earlier, that sex and sexuality is a very broad, big topic. If you have one round, as you call it, and your partner gets their orgasm, they are happy, you are happy. Tomorrow we've got a job, we've got other things to do. Why do you want to mate the whole night? On the contrary, if you get 3 rounds and your partner does not get an orgasm, you've just been useless, because she or he doesn't know what you were doing. You've just been pumping and rocking them up and they still didn't get their orgasm. So as in a relationship, what is key is that, are you fulfilled? Not how many rounds you did. Is she or is your partner fulfilled? That is much more important than how many rounds did I do. If you last 2 minutes and she has hit cloud 11, she loves you very much. If you last 30 minutes and there's no orgasm, she's like, oh, damn it. Hey, this person just hurt me. I'm not going there again. She still need to get the job finished somehow, somewhere. That's not all right. So this issue of rounds is a myth. What is more important is that, are you as a couple sexually fulfilled? And it doesn't only take a penis to do that. It takes every little thing, including your 10 fingers and 10 toes and other things. On that note, thank you very much for your attentions. My staff is signaling to me that it is time to start consulting again. And good day and good luck.
Doc, thank you so much for your time. Thank you for your wisdom. And more importantly, thank you for sharing such consciousness within men's health. And we truly appreciate it, Doc.
Thank you, guys. Bye-bye.
Bye. Colleagues, I think as you saw, the doctor gave us a lot of information regarding men's health. As we conclude today's session, I want us to remember that good health is not only about living longer, it's about living better. As you know, that men's urological health remains one of the most overlooked aspects of a well-being for a man, and yet it directly impacts the quality of life, productivity, relationships, and more importantly, longevity for a man. So let us make sure that we adopt a healthy lifestyle, stay active, keep checking, have a balanced diet, stay hydrated, and let us continue this conversation and support one another and take ownership of our health. Because when men are healthy, families are stronger, workplaces are more productive, and communities thrive. Thank you. Should there be any questions, colleagues, please make sure that you can email all the questions to marketing@urology.co.za, and then the doctor will answer these questions offline. I'll say it again, if there's any questions from any of the colleagues, you can email them to the doctor at marketing.urology, urology.co.za, and those questions will be answered offline. May everyone have a lovely day ahead, and let's take care of ourselves as men. Thank you.